Hello friends, I am Dr. Anubhav Gupta and I am a consultant plastic surgeon working at Sir Gangaram Hospital. Today I am going to talk about hand surgery. Now, hand surgery is a very vast field which involves a lot of conditions. Like if you look at congenital, since birth there are many kids who have absence of fingers, absence of thumb. Then there is many times the fingers are joined, a condition called syndactyly. Then there are many times extra digits, which is polydactyly. So these are the common conditions which are present in our hands at the time of birth. Then there are many conditions which are acquired. Like for example, there are injuries, common cuts in the kitchen, then the finger getting into a washing machine, simple cut by a knife, then road traffic accidents wherein the part of hand is cut from the body, it is amputation, abrasions, avulsions, crushes, bruises, all these kinds of injuries, loss of tissue, fractures of all these come into under the purview of hand surgery. Then nerves, injury to nerves, tendons. Then the third group is the burns related. When there are burns of the hand, they cause contracture, they cause abnormal positions of the joints with inability of the person to do his work. So these all categories come under the gamut of hand surgery. Now, who is qualified to do hand surgery? Well, the basic training of at least a person should be a qualified orthopedic surgeon or a plastic surgeon with special interest and having worked in the field of hand surgery. Such people are more qualified to do hand surgeries. I always tell that we should never take any injury to the hand lightly, because there are very important vital structures which are moving under this skin. There are tendons and nerves, a lot of things which make this hand work. So even if there's a small cut, it should always be supervised or examined by an expert, because even a small cut can cause injury to a vital structure leading to loss of function. You can compare our hand to a crane. For example, the crane has a metallic part, then it has a lot of wires which act as pulley for picking up the weight, and it has a wire circuitry which is electricity which provides it. Similarly, if we look at our hand, the bone, soft tissue provides the framework of metal, just like crane, and the pulleys, the tendons and the ligaments, they are the pulleys for lifting the weight, and the electric circuitry are the nerves. So if we look at this analog, so hand works like a crane. So any part of this complex system, if it is injured, then it is not going to work properly. Again, another thing which we should understand it, many times even after surgery, the return to function depends on a lot of things, like physiotherapy, exercise, what your surgeon tells you. It is like a machine. If we don't use it, it will rust and it will not work. So we have to understand the complexity of the injury, the outcomes which are dependent on not only on the surgery but a lot of other factors. For example, the education of the person. If he is well educated, there is always a chance that the person will understand the mechanism how his hand works, and he will be able to get a better result as compared to the person who doesn't understand the importance of these systems.